Tricia came in to see me after a few years of having some pretty severe shoulder pain. She had an accident where a dresser fell on her and she tore both of her rotator cuffs.
I had 600 pounds of furniture fall on me all by myself. It was on a Friday afternoon and I knew that nobody would miss me till Monday morning when I didn't show up for work. So I had to literally push 600 pounds off, and when I did, I ripped 3 of the ligaments out of both of my shoulders. Did not know this for 5 years until I started losing use of my arms.
When she came to see me, she had a lot of pain in both of her shoulders and she was unable to raise her arms above shoulder height.
Couldn't hardly wash my hair, put on makeup, I couldn't put up dishes. It was absolutely ridiculous. I had a brand new grandson, could not pick him up. I went to 2 other doctors and they were older doctors. They were going to do the old technique and they told me more than likely I would have less, not even this much, So I said, you know what, I'm not going to do this, and almost gave up when a friend at work said you need to go to North Texas, Orthopedics, and I was like, I'll give it another shot. There's got to be somebody out there.
We talked to her about her options, both surgical and non-surgical treatment options, and we thought that her best option would be to do a specific type of a shoulder replacement called a reverse shoulder replacement.
And so I said, okay, how much is the recovery? He said, 2 weeks, 3 at the most. I went, could you put that on paper for me? I don't believe you. Who has surgery and recovers in 3 weeks?
With a reverse shoulder replacement, there's actually less rehab than a conventional shoulder replacement because you're not relying on the rotator cuff to move your arm. You rely on your deltoid muscle, which is not injured or traumatized as much by the surgery. In a regular shoulder replacement, this is a model of a right shoulder, with this being your arm bone. Here's your ball and here's your socket joint. And with a traditional or conventional shoulder replacement, we replace the top of the ball with a new ball, and then we replace the socket with a new socket. But in a reverse shoulder replacement, we actually take the ball and turn it into a socket, and we take the socket and turn it into a ball. And that allows a different set of muscles to raise your arm, and it gives you a mechanical advantage to regain some of your function without a good rotator cuff.
He lived up to everything that he promised me. I am in no pain. The recovery was amazing.
She's done really, really well. She's back to most of her activities pain-free, and we've been able to give her her quality of life back.
I'm grateful every single day what Dr. Stehly did for me. Whoa!